Welcome back to another episode of Global Desi Women, the podcast where we celebrate powerful voices, extraordinary stories, and the impact of global Desi women around the world. I'm your host, Arti Salanki, a business coach, real estate broker, and an entrepreneur. Today, I am thrilled to be joined by my amazing co host, Dr. Reena Jasani, physician and Master of Public Health graduate, currently completing her anesthesiology training, and my other co host, Vinoo Palicha, entrepreneur and a founder of Vdesi, where you can find beautiful ethnic wear collection. And let's have a drum roll. Our guest today stands at forefront of healthcare leadership, driving real challenge with integrity and purpose. Malisha Patel, Senior Vice President and CEO of Memorial Hermann Southwest and Sugarland Hospitals. Malisha is nationally recognized healthcare leader, a Malcolm Baldrige Award winner, and a trailblazer who has made it her mission to improve the health and well being of our communities while breaking glass ceilings in the healthcare space. I mean, I can go on and on and on about Malaysia. She is just everything that Global Desi Women stands for. So, Melissa, thank you and welcome to Global Desi Women podcast. We are honored to have you.
Arti, thank you so much. And wow, what an introduction. I'm really, truly honored and humbled to be here and to join your co host. So thank you for having me.
Thank you. Thank you. We appreciate that. So, I think we can start by your journey into healthcare leadership is so inspiring. So, can you share us a little bit how it began and what sparked your passion for healthcare administration?
I'll tell you, healthcare administration came later in life. And I think many Vdesi women or just anyone within our community probably have experienced at some point in their careers or in their life journeys where their parents have encouraged them to be a physician or somebody in healthcare. Growing up, I thought that I was going to be in. And not only was it something that my parents wanted, they wanted to, have a doctor in the family. Uh, but I naturally thought that that's what I wanted to do. I always wanted to help people. I didn't know what form or fashion that was going to be in. So I always assumed that I was going to be a physician. And at the age of 15, I started volunteering. Now we just call them hospital volunteers, but back then there were candy stripers. And so I was a candy striper and I volunteered during the summers in different departments. And I knew this is where I wanted to be, is to work in a hospital with people and helping people. And my freshman year in college, so I'm a Longhorn, so I'm going to give a shout out to all my
Yeah.
I was pre-med and I I had a big event happen in my life, and that really made me really consider, is this the path that I want to be on? I lost someone really close to me. For many of us, our grandparents are very close. And my grandmother lived with me just a few months after I was born. And she was a mother figure in my life. Similar to my mom, I was just blessed to have two in the same house. And losing her was a lot. And that was the first time I had to deal with grief. And that was heartbreaking. And just going through that process, I told myself, gosh, I don't know if I want to be a physician. This is hard work, right? Building relationships, close ties. And, when you do that, you bring people in similar to being your own family.
Yeah.
And I said, I can't do that. I can't. I mean, I have family and friends, and imagine bringing in another group of folks like patients that I could not handle that. And so that year, my second semester in college, I was at the business school just walking through, and I saw some flyer on healthcare administration. And it was intriguing. So I told myself I was going to check out the forum that they had. And there was a professor from a different university talking about a master's in healthcare administration. And I gosh, how random, and what a it was like a calling. Like, oh, this
Yeah,
is
it was.
it really was, because I sitting there, I was just processing, oh, I could do this. My I could still be in the healthcare space, still impact people, help people. And I come from a business background. My parents are in the business community, and I thought I could use that skill set, something that comes so naturally to me,
Yeah.
and combine the two. And I have not looked back. And so at that time, I continued as a biology major, but I did a minor in a business. And I, at that point, decided that I was going to continue with a master's in healthcare administration. And I did my master's at the Trinity University in San Antonio.
Wow.
And so it really took a life event to help me on my journey to start this path in healthcare. One of our co-hosts, Reena, you're a physician, so I'm sure you have your story. But today I get to work with physicians, and I'm in awe of our healthcare workers and colleagues, and just the work that they do every day and the many sacrifices they make.
Yeah, it's so true. And like you said, that for you, it was like having that connection with some patient. And then if you lose that patient, and I'm telling you, it's hats off to all the doctors out there. I really, really appreciate what they do, because I know my mom was a cancer patient, and it was so overwhelming for me to see how wonderfully they would treat my mom and care for her, and like have that compassion for each patient and the patients they have, because not all the patients are similar. And I used to hear the stories from the doctors of plenty of times where they would come and say, because my mom was always, even though with a lot of pain, she was always smiling and had cracking jokes with the doctors and nurses. And so they would come and tell her, like, we come across so many different patients, like not everybody's smiling like you are, but we still have to have that composure and still be able to treat them. And that takes a lot. I feel like that kind of made me feel I saw it very up close and up front, how the doctors and nurses and every staff member in the hospital works. And I truly, truly appreciate each and every one of them, how hard work it is. Not everybody realize that, but it's a lot of hard work, and hats off to them, the patience that they have for every patient. It's really incredible.
I completely agree. I would say that, we always talk about, with my team, or, when we have town hall meetings, we talk about, when patients come to a hospital, or when folks come to the hospital, unless you work at a hospital or maybe you're delivering, no one really wants to be at a hospital. Uh, and so we need to be at our best when our patients are not us, and that's hard, and it's hard. And being in healthcare, you're surrounded with people that are compassionate and caring, and this is why they do it. And I think about folks that work in the ICU or in the ER, and one minute they're dealing with a trauma, and the next minute they're saving a life, and it could be two very different experiences and outcomes, but they continue to move on and still deliver with compassionate care. And I agree, hats off to all of our healthcare colleagues.
Yes, absolutely, absolutely.
So I'm gonna ask a very basic question to start off with is like, what does a normal work day is like for you?
Well, no day is alike, so I will share that. But I think that's what makes my job so much fun. And it's not. I don't feel like I am coming to work, because I really do enjoy what I get to do every day. We have a lot of early meetings because our days get started early. So there's a lot of same meetings. If we're meeting with physicians or surgeons, that starts at 7, because we want to try to get to the physicians before clinic or before they start surgeries. My focus is on safety first and foremost. We have every day, I have a daily safety huddle, and we bring all the leaders throughout the hospital, and we do a check-in on, are there any concerns, anything that we need to be aware of that could be of concern of safety. So it's just a really nice check-in. So daily, that is probably the one consistent meeting that I have every single day. Outside of that, it could be meeting with, I would say I have two communities that I work within. I work within the hospital healthcare community and then the community that we serve. And so within the hospital, maybe we're developing a new program. So meeting with the group that's helping us develop a new program, whether it's a new procedure that we're bringing or we're expanding a new expansion project. So it could be capacity or capability we're talking about. We talk about strategy, whether it's growth or development on the business side, operations. Process improvement is a part of everything that we do. We talk about experience, patient experience. What could we do better? What do we need to work on? So really, you think about a business, it's really very similar. That we have a customer, but our customers are not just the patients. Our customers are also their family members. Our customers are our physicians, because our physicians have choice. And we want to make sure that our physicians have a great experience, because that we do want them to choose us.
Let's take a quick break.
If you've ever wondered why billion-dollar brands like Kodak, Blockbuster, and Tower Records became corporate catastrophes, a new podcast called A Case Study in Corporate Fear has done the forensics and revealed that the real culprit was fear. Fear made Kodak bury its invention, the digital camera, and persuaded Blockbuster to pass on buying Netflix. It's a podcast that's been called True Crime for Brands. Listen to A Case Study in Corporate Fear today and learn how others failed so you never do.
So how much of as a CEO role, how much of your role manages, I would say, from the littlest thing that happens in the hospital to the largest thing that happens in the hospital? How can you give us example of, like, as a CEO, what do you have to really, what is the smallest possible thing that you had to manage to the largest thing that you had to manage?
I think that's a great question. And if my team was on this call, they would laugh. I would say that I like to touch it all. And that's because I am hands-on to some degree. And so it could be as small as an email that's going out and what we say that's really important to me. The detail matters. It could be as small as a paper on a bulletin board that's expired, and I'll take a picture to the team and say, hey, why do we still have something about the blood drive on from last week? So it could be that small, but that's important because details matter. And as large as, the pandemic, right? How are we going to manage through the pandemic? Whether it's, how are we going to take care of the community when we don't have the protocols on what to do? How are we going to develop that? How are we going to create that? Who are we going to work with? And I'm very fortunate that I work with a great system in the greater Houston area, and so many healthcare organizations came together, but there were a lot of big decisions that we had to make. How do we engage the community as part of to educate them, to bring awareness? And so it could be something as significant and large as the pandemic, or to something really small. But I think the job of a CEO or an executive is really to know what's going on, to have a pulse on the small things, but be ready to take care of any of the big things that come up as well.
That really makes you a really awesome CEO. That's what it is. This is how a really good CEO sounds and does its jobs.
I think that, oh, sorry.
No, I was just going to say, but I would tell you that I think the most important thing that I do is making sure I have the right people. Leadership is extremely important. And at no point will I say I'm the expert, but I do surround myself with some amazing experts, whether they're clinicians or non-clinicians. But, I'm not the expert when it comes to primary care or perioperative services or nursing. We have to bring the right people to the table to make those decisions. And so I really am very fortunate and grateful for the leadership team that I get to work with.
Absolutely.
I love that you are daily having the safety huddle so that you can get feedback from the different physicians and members of the hospital and really get in touch with what's working, what's not working, and what's missing. Because I think sometimes there can be a disconnect between the healthcare administrators and the physicians. So that's really great that you're trying to keep in touch with what the physicians think on a day-to-day basis would affect the care they're giving their patients.
Yeah. Yeah. Reena, does it sound more like what you experience, or is it a little bit different?
I did not, no. I only have to interact with one patient at a time usually. So I don't have to worry about like the larger scope, luckily. So for me, it is a much more narrow focus, which is for me what I wanted. So I don't have to worry about expired flyers, but I do worry about expired medications. I have to make sure I don't give those to the patients. Then, if we notice that the wrong medication is in the wrong drawer or labeled incorrectly, then we would report that to someone above us. And then probably would go up the chain of command, but I'm pretty low in the pyramid right now.
Right, right. So,
Not at all, Reena. I'll tell you, our anesthesiologists are in demand, and so we play a very important role.
And there's definitely been a lot more use of anesthesia outside of the typical scope, with some people wanting it for, imaging if they're uncomfortable in a CT machine or an MRI machine. So there's definitely been increased use of anesthesia. And that's probably something that maybe people have come to you to talk about to figure out how to set up providing anesthesia care in different locations than they typically were in.
Absolutely, and that is some of the increase in demand that we've seen, whether it's in the cath lab or imaging and non-traditional spaces.
yeah, yeah. So you've managed large scale hospital operation and led a multi-million dollar expansion and of course achieved recognition. So what are the key leadership principles that you have guided that have guided you through such an high impact role?
What I'll do, Arti, is I'll start with sharing a little bit about my journey because I didn't answer that first question, and I think it's the journey that helped me with the leadership style and principles that have been important. And so after graduate school, I had the opportunity to work at the VA. I spent a little under 3 years at the VA, and working for the Department of Veterans Affairs, I would say, was probably one of my most humbling opportunities.
I thoroughly agree. I have worked at the VA, and it really just shows you how inefficient things can be when certain things are missing, when like the medical software system is different, the medical record is not the same and is not as up to date.
It's such a great experience and such a great environment, and I learned so much. And we're supporting our veterans, folks that have sacrificed so much for us being here. And I think that was just such a great experience for me, being able to rotate through the different departments of a hospital, being exposed to clinics and physicians in a whole different capacity than I had volunteering or through grad school. It was real work experience. And that's when I got my first leadership experience, managing departments in my early 20s. And, that's been, no one's perfect. I'm not perfect. I'm still learning every day, but that's when a lot of my learnings in leadership began. And from the VA, I transitioned and I went to the for-profit healthcare sector. I worked for Tenet Healthcare Corporation, and I did consulting with them for a little over a year and a half. And so going into the hospitals and helping with process improvement, where we helped with turnaround, helped them be more efficient, helping improve scores, whether it was experience or improving efficiency times. But that really helped me with the baseline of what are the things that make the hospital hum? What's really important? So that was a great experience. And then for the past 18 years, I've been at the Memorial Hermann healthcare system.
Wow.
I started at Memorial Hermann Sugarland. I came in as a Six Sigma black belt. focused on process improvement. And over the past 18 years, my journey has led to me being over departments, to director of operations, to chief operations officer, helping with expansion projects, to large initiatives, to the role that I'm in right now, where I've been the CEO for the past 7 years.
Wow. I think this is what makes the difference, right? Because you've been into so many different departments in the hospital itself. So you've seen it all up front, how it is done. And so you can really, I guess I can say that you can really know the ins and outs of that each department. And that's what makes you so unique and so powerful, I guess I can say.
It is a great experience. And it's also, you're right, it does make you dangerous, but not dangerous enough, because I know what questions are important to ask. And it's really, at the end of the day, the front line is our best resource, right? They are closest usually to where we may have opportunities. And so it's important that we as leaders work with the team working closest to our patients. But during that journey over the past 20 years, my leadership style has evolved. And I've learned that it really is situational. It's different because different moments require different approaches. But one thing has always been true, and that's leading with my values. I feel like that's always been given me clarity early in my career, right? Being honest, being ethical, putting the patient first, being compassionate. Those type of things have extremely been important. And also, I have learned over the years by observing, and I'm sure many of us learn by observing, where I've learned what not to do, and I've learned what to do, right? Like, oh, I love how, maybe that individual managed that difficult situation. I'm going to make note of that. And I've also learned the opposite. Like, I would never do that. I'll make sure I would never treat someone like that if I ever had the opportunity to manage something like they do. And so I think those observations have been really important to me in helping me build my leadership style, which I really strive to be authentic and always principled and adaptable, right? Being adaptable to the changes, because that's the one thing that's constant is change. So we're constantly adapting to that as well.
Right. So is there, like, I would say, many South Asian women look up to you as a role model. And what challenges did you face on your path, especially as a Desi woman in a leadership? And how did you overcome those?
I would say that whether it's being a Desi woman or being a woman in general, or it really could be anyone today. We were recently at an event and we were talking about barriers and challenges and how to navigate them. And after the meeting, I had two young male professionals come to me and say, gosh, I had to navigate something very similar in their work environment. And so that allowed me to reflect that it's really everyone that has their moment, depending on the group that they're in or the network that they have, the challenges that they may face. And I think I've faced both visible and invisible barriers, right? And, there have been times where maybe I was the only woman in the room, maybe the only woman of color in the room. What I would just say is it just felt like I've always had to work twice as hard. And just to prove that I belonged, or to be seen, or to be heard. And I don't think there was overt discrimination. I think that natural bias does exist, and it's on us on how are we going to help folks overcome them. And that's where the hard work comes in. That's building those relationships. It's educating folks. It's letting folks see you and for who you are and what you could bring to the table. So people don't make assumptions about your capabilities. And And I think that happens when you may not have the same access or network as others, is overcoming that. I wouldn't say that I'm unique in that. I'm sure everyone on this call has probably had to manage through that, but many of us. And what I always tell folks is, so what are we going to do about it, right? It's important for us to show up, and it's important for us to, when we see an opportunity, to bring awareness to it. And I recently shared, Arti, I think you may have been at that event, and we talked about the specific physician meeting that we have. And, at the table, this was, 15 plus years ago, it was primarily male physician leaders at the table. And we had a handful of female physician leaders. But when they came into that meeting, they always sat at the back, even when there were chairs at the front and at the table. And I remember, because I sat at the back too, but when I became a CEO, when I saw that behavior after a meeting, I specifically asked one of the female physicians, I said, how come you don't just sit at the table? And she said, well, I just thought I'd sit in the back just to leave room for other folks coming in. And that's so similar to behaviors that we've been brought up.
Yeah.
Growing up. And I remember growing up that, you respect your elders, let your elders sit down before you. If someone's, even if I was the leader in the meeting, I'd make sure everyone else has a seat first.
Yeah.
But it's important, if you're having the discussion and if you're owning the meeting, and that voice is important, that they really need to be at the table. And that was a really big aha moment for me, because I said to her, I said, next time, join us at the table. And she did. And I think it's just creating that space that it's okay, or just bringing awareness to it, because I don't think, her intention was, it was all positive.
Yeah.
She just,
It's like the acknowledgement, right? Because it's like without that, it just never strikes you. Like even sometimes our own behavior, we don't really realize that this is how I'm doing. What am I doing? Until somebody notices and you get that acknowledgement, and you're like, oh yeah, why am I doing this? I should be upfront. So wow.
and I would also say, similar to what we've talked about, is, remind yourself that when you are at the room, you bring others to the table and other voices, because it doesn't matter if it's male or female, just diversity in thought, right? If I have a meeting and I just have nurses, well, I need to make sure my doctors are there, my therapists are there. Like, are we representing everybody? And I think that is extremely important. And so over the years, I would be remiss if I didn't share that mentors have played a critical role for me as well. And majority of my mentors, most of my career, have been male mentors. And over the years, and recently I've had more female mentors, but they've opened doors for me, and they've created possibilities for me that I would have never imagined. And so it's important to build those relationships, and they've played a huge role for me as well. And I think being intentional and pulling others with you is also very important.
So winning, the award, the Malcolm Baldrige Award, is incredible achievement. And what did that journey look like? What can other organizations, I guess, can learn from it?
Well, I'll start from the beginning, but I'll share with everyone what that recognition is. The National Malcolm Baldrige Award is the highest award given for performance excellence. And it is given by the President of the United States. It's an application or process that falls under the Secretary of Commerce. And it really, in its original purpose, is to create better businesses and opportunities, and really having businesses excel, and as we compete with others across the world. And so this was probably I believe in the 80s, this award was established. And so I would say it was, in 10, 11, that the CEO that I was working with at the time said, we should really explore this Malcolm Baldrige Award, because there are at a number of healthcare organizations across the country that have this recognition. And so I recall he said, Malisha, I want you to help take lead. And we scheduled 4 hours with a small group of us leaders, and we started going through this application. Well, in 4 hours, we didn't answer the first question. And it was a 7-year journey for us. And it touches multiple categories, from leadership to strategic planning, customer service, workforce, operations, really how you manage an organization. It focuses on processes and then outcomes. And you really ask yourself questions. And that process, going through working as a team, going through the state process and the national process, it wasn't about, surveyors coming in, seeing if we met the criteria for the award, but that process made us better every time, because what they gave us was a gift of feedback on what we could do to be better.
Yeah.
And it was 7 years after we started our journey that we were recognized as a Malcolm Baldrige recipient.
Wow.
And it was just a phenomenal experience to be there with so many of our team members that played such an important role driving it. And the thing was, everyone was in it. Everyone was in it because it was the right thing to do, because we want to be the best. We want to be the best because we get to take care of people. We get to take care of our patients. We get to take care of our community. And why wouldn't we want to be the best? And it's the processes, it's what's hardwired us. I tell folks that's probably the best leadership book that I've read, this criteria, because it really challenges you on leadership. And what are key things that you should be looking at running an organization.
Wow. What an honor, right? It's incredible. And of course, a lot of hard work to get to that point. And so Malisha, you serve in a lot of community and healthcare boards as well. So why is community involvement so important to you, and how do you balance it all, like with your demanding role and plus taking part in the community and making sure you are part of the community? It's a lot of time involvement, a lot of I guess work life balance. I know you have little kids, so even today I appreciate you had to manage with have coming on the call. You had to do some management there. So how do you manage it all?
Well, I'll be honest, I don't manage it all, and I definitely make mistakes, but I have an amazing support system. I'm very fortunate. I have an amazing husband that supports me. My parents and my in-laws are out of town, so I am envious of folks that do have parents and in-laws in town, but they are a phone call away. And so if I do ever need them, they're available. But I have someone that comes and helps me every day, and she's a part of our family, and she's been instrumental in allowing me to do what I love to do and help me stay centered in what's most important to me, which is my family. And I would say it's been a journey, right? Where earlier in my career, what was important to me is very different than what's important to me now. And family's always been important. But when you have your own family, that changes. So my time commitment, where I want to spend my time. And you mentioned something, you said work-life balance. And I would say that there is, I don't believe
It doesn't exist.
It does not, but it's more of a rhythm, and it shifts with different seasons, right? And
I feel
and so-
like I feel like it's the we all use that sentence very easily, like work life balance. But as a mom, as a business owner, I feel it, because it's not every day is not the same. There are different priorities, and there are different days that you do have to check what is more important than the other, and then go from there. It's like what you said. It's never the same.
And that's one of the reasons, right, why we're asking our kids to go wherever they want to, get the experience, get the exposure, and then kind of come back.
Come back, right? That's what they
The
all
support
say.
system is here.
It's true. It's true. And then you have to get there yourself.
Yes.
You have to make that realization yourself. And I have over the years. And I've learned to give myself grace. I've learned to prioritize what matters most in that moment, and to ask for help when I need it, which is hard to do, but ask for help. I learned to take care of myself, and then also to integrate the two when I can, right? Because I don't want there to be two separate versions of myself, the one at home and the one at work, but when I can integrate it. So if I am going to a community event on the weekend and maybe it's a health fair or a walk, maybe a March of Dimes walk, I'm going to take my kids with me, right? Because it's a good thing to do. We all get exercise. It's for a great cause. And so when it can integrate, allowing it to integrate. But I would say over the years, I'm definitely more selective on what I'm participating in, what boards I'm aligning myself with. And it's usually those that have the most impact or something that aligns to me and what's important. And, I have someone once shared this with me, and I'll share it with whoever's listening because I think it's important. I won't take something new on until I take something off. Okay. And that just allows me to prioritize my time. And so as soon as I finish one commitment, then I may consider another commitment or opportunity. But it has to align with, is this aligned with what's important to me? Does it align with my values? And I would say I've been a part of some committees or boards in the past where I did it because I was asked. Where now, that's very different. It's okay, am I the right person for it right now? And asking the right questions. But it's important to me. Community is important to me. That's how I grew up. In the community that I grew up in, the community that I was raised in, really influenced why I want to continue to give back to the community. So for me, it's, I'm passionate about healthcare. I'm passionate about helping people, helping women, helping our community. And so if it makes sense, then I'll definitely be engaged because I think that's what impact is about, doing something greater than yourself. Yeah. And I get to do that in the work that I get to do.
I really like what you said that you don't take something until you take something off you. So it's really nice because over the years I also learned to say no. I had a hardest time doing that, and I was the kind of the person who would always be like, if somebody asked for something, I'll be like, yeah, I can do it, and not realizing what am I getting into. But I was always there. So I had to learn and practice to say no, that I can't be doing this as of now, but maybe later I can help you. Or it just depends on the situation, right? Of course, it's an emergency, I'm going to go for it. But like, it was very difficult for me to learn no. And I think a lot of women can resonate that because I think as an Indian woman, we have the hardest time of saying no because we've taught that helping somebody is put somebody else before you. So that's what we are wired with. So saying no is difficult for us.
I think it's also hard to delegate, especially when you're overseeing everything and you have lots of amazing projects that you want to fulfill. It's hard to kind of step back and be like, okay, I don't actually need to be the one sending out the email. Like maybe someone else can do that. And I can focus on dealing with this little obstacle that we need to overcome to get the project running back on track.
No, I agree. I will share that. I'm still learning to say no. I'm not saying that I've mastered it, but I'm constantly working on it. And I think you said something really important. I think many of us work through this every day. It's because we're wearing so many hats, right? Whether we're taking care of loved ones, whether they're our kids or they're our parents. Yep. It's our friends, our families, our neighbors, but constantly being called upon for help. And it's because we want to help. Yeah. And we want to be the best. For me, I want to be the best sister I could be, the best mom I could be, the best daughter I could be. So we're constantly playing all these roles. And that's why I've shared that it's how we prioritize our time. I remember listening to some episode on NPR years ago, and it really put my time with my kids in perspective. And this speaker on this NPR show said, you only have 18 summers with your children.
Yeah.
And that hit home for me because now I've been counting down. And now that my son is 13, I say, oh my gosh, I only have like 4 more years, 45 more years until he's off to college. And so that really prioritizes my time.
Yeah. It's funny that you say this because for me, it's the other way around. I tell my kids, like, think of it that you have 25 years with me now because as you grow and as you get into 50s, and so I consider up till 75, maybe I'll hopefully be healthy and be around. So I keep reminding them, you have 25 years to spend time with me. So sure, you make the most of it. So for me, it's the other way around, but it's similar. So another thing I want to say is that you were honored as one of the Houston Business Journal's most admired CEO and 40 under 40. So what does recognition like these mean to you and how do you define success beyond award?
Well, first and foremost, I would say that I both of those recognitions are very humbling for me. And I'm truly honored to be recognized by my colleagues and my team that I get to work with every day. So that in itself is a privilege for me. And for me, it just validates that I'm doing the right thing. How lucky am I that I'm being recognized for the work that I get to do every day. But really that recognition it really is a reflection of the team. I'm only as good as my team and the people that I get to work with. And so I would say it's theirs just as much it is as mine. But you mentioned something about success, and I will tell you that for me, success has also evolved over the years in defining what success is. And earlier in my career, I would say it equated to achievement, right? Whether it's titles or milestones or that recognition. And while those accomplishments mattered, over time, it wasn't the full picture for me. Today, success for me is more where I get to make an impact and where there's alignment. And we talked about that alignment.
Right.
It's about making a meaningful difference in the lives that I get to touch. I lead communities that I get to serve. It's about making an impact and taking care of my family. And so the definition of success has changed for me, but it's about staying true to my values and creating opportunities when I can. It's about balance with all the roles that I have and that we play and that we get to play, and to be present in those roles. Whether it's a family member or a mentor, a friend, or an executive, to be present in each of those roles. And so that's what success. Today, it feels not like a finish line, but more of an ongoing journey of growth and purpose.
Absolutely, absolutely. So you are leading both the vision and the heart in the field that demands both. So what advice would you give to young women who dreams of making a difference in the healthcare?
I'll share my story. So one, I never imagined that I would be serving as a CEO of 2 hospitals in the greater Houston community. Up until college, I never even knew what healthcare administration was. So to dream big. And in graduate school, we did a personal statement of where you see yourself. I think it was in 15 or 20 years. And I wrote a note to myself that I hope to be a chief operations officer of a children's hospital, and I want to have a family. And that's as high as I visioned myself to be, right? Wow. And so to be able to read that and say, gosh, you could definitely do more.
Yeah.
That it's the opportunities are, there's no limit on what you could do. I would say yes to opportunities before you're ready.
Yeah.
To have a growth mindset, to learn to fail, to get up and repeat it again.
Yep.
And don't wait for the perfect timing, because there's no such thing as perfect timing. Take the risk when you can. When you can. It depends. That there's different times in your life than when you can take the risk and when you can't. I would say speak up for what matters. And even when it's hard, especially then, because that's when it matters the most. I've heard you say this word, being uncomfortable, but really, that's when we grow the most, is just being uncomfortable. So being comfortable with uncomfortable, and don't forget to take care of yourself along the way.
Yep, absolutely. Very well said. Very well said.
This actually applies to everyone, not just, I guess, aspiring, newcomers. It just everybody in general should follow those rules.
Great life advice.
Yes.
Yes. So what is next for you? What's any exciting projects or vision that for the future that you'd like to share?
Well, right now, in the role that I am in, continuing to excel and make an impact and grow in the communities that we're serving. And as far as what's next, as I shared with the advice that I shared, have a growth mindset and being open to learning. And that's the thing about healthcare and the field that I'm in, is it's complex and it's constantly changing. And so for me, it's to be a part of that change and continuing to learn and see how I could continue to make an impact, because what I'm doing today will not be effective tomorrow. I'm going to have to continue to evolve and grow as well.
Yeah. So well said. So, Malisha, thank you so much for sharing your journey, your wisdom, and your heart with us today. Your story is a reminder that leadership isn't just about titles, it's about purpose, service, and resilience. You've shown us how healthcare leadership can be compassionate, bold, and community driven. We are truly inspired by you and your story of how your journey was. And thank you for being such a strong role model for all of us, and also as a Desi woman, not just a woman, but also Desi woman. It's for leadership everywhere, right? But your story will stay with us and it will inspire all our listeners. So, to all our audience, if you've loved this episode, please don't forget to subscribe, leave a review, share it with someone who needs an inspiration today. And if you want to give someone a special shout out, whether it's for birthday anniversaries or just sending a love message, just send us a message and we will definitely give a shout out on Global Desi Women podcast. Reach us out and we'll make it happen. And if you simply like to support, we will support us. You can also buy us a cup of chai. So keep that in mind. So until next time, stay empowered, stay connected, keep shining, and of course, be kind to yourself and to others. Thank you so much. We truly appreciate it.
Thank you for sharing your story.
Yes.
Thank you so much for having me. Thank you.
Thank you.